So let's start with
Okay.
what Akansha was like a child.
As a child, I was a very, I was a never student. Like I was never a very topper student. I was, I was always in the mid. My rank used to be in the middle only. And but one thing was, but one thing was very, which I like in myself, that I was very consistent about anything, from the childhood, and I was very hardworking also, and
Fantastic.
I think that has helped me
Hmm.
a lot.
Great. So, like, how did you start when did you realize that you're interested in women's health?
Actually, I think it's all destiny. Till 10th, I was not at all aware. Even I did not know that I'll be becoming a doctor or something like that.
Hmm.
And
Hmm.
but somehow I took math. Biology. Biology I took because of my father's pressure only. Because at that time I liked maths more than bio. But anyways. It was like destiny, but then after I took bio, I started enjoying it, and then I started preparing for PMT, because in India at that time in 2005 2006, it was like, if you are a science bio student, you have to go for you have to prepare for medical, and if you're a math student, you have to prepare for engineering. So I
Engineering,
started
engineering,
preparing.
yeah, yeah,
Yeah,
yeah.
so I started preparing for medical at that time,
Okay,
and
okay.
fortunately I got into it.
Wonderful, wonderful. So tell us about, what is that particular aspect of your work that gives you the most joy? Laparoscopic surgery, gynecology. What is the talk to us about? Give us
Yes.
stories. Talk to us about,
Uh-huh. See, overall, I completely enjoy my this whole profession. Be a taking care of the NC patients, be it delivering the babies or doing laparoscopic surgeries. Everything, both of them are completely a different thing. Practicing in obstetrics has its own pros and cons. Like you have to be mentally prepared for every emergency,
of
चाहे
course.
वो रात में it is at 2 p.m. चाहे morning 6 p.m. 6 a.m. or anything like that. And laparoscopic surgeries are completely different thing. You have to be completely vigilant during the surgeries. So I actually enjoy both of them. There's nothing like that ki I particularly enjoy delivering the babies or particularly enjoy doing laparoscopic surgeries. I enjoy actually both of them. I enjoy.
Now, what are the most rewarding aspects of performing laparoscopic surgery? Is there any particular case that stands out in your mind?
Yes, it is better in every aspect, unless until there are cases that you cannot do because of complication. That's another thing. Otherwise, laparoscopic surgeries are better in any aspect when compared to open surgeries, because obviously the first and most foremost thing is that the scar incision is
A lot more.
you are free of scar basically, and there is lesser bleeding during surgery. The You get magnified view of anything, so the chances of complications or injury to the other body parts are very less. Recovery of the patient is very good after laparoscopic surgery, because generally we allow the patient to even walk after 12 hours of surgery. And apart from walking, their all bowel and bladder, everything, recovery of the patient is very good, and they do not need a prolonged bed rest. And they are basically pain free after 2 to 3 days. They are basically pain
Right,
free.
right, right.
So in every aspect it is good, but there are some contraindications in where you cannot use laparoscopic surgery. In that case, you obviously have to go for open surgery also.
Okay. Is there a particular case that you want to share or anything like that along those lines?
Uh, as of now, I'm not remembering any case, but usually we prefer laparoscopic surgeries over open surgeries, unless if patients are ready. We generally prefer laparoscopic surgeries over this open.
Laparoscopic. Now, what do you think? Is there a big misconception to patients about laparoscopic surgery that you've heard that you wanna,
Yeah,
take this
actually,
platform to
see, this
discuss?
is
Yeah.
basically this in this usually the incision is very small. See, so most of the patient, particularly from the rural area, they are like, मैम इतने छोटे होल से वो सब कुछ निकल जाएगा कि नहीं निकलेगा, मतलब कि will there be anything remaining inside that? How can you remove all these things through that one small 1 centimeter hole? So will I be disease free or not? So this is a completely a myth. The laparoscopic surgery are completely, in fact it is a better surgery in fact, because there are basically everything is magnified, and there are different techniques to remove the organ. To how do we remove, there are different, we cannot obviously explain all this those techniques to the people, but yeah, everything is removed in laparoscopic surgery also. Suppose if I'm doing a uterus removal surgery, obviously I will remove whole uterus, I will not leave anything inside if I'm doing laparoscopic surgery. So this, there is a big myth among the people that something will be there, they will not be completely disease free if they go for this laparoscopic surgery.
Absolutely, absolutely, of course. So, yeah, tell us one thing, like, how do you approach patients who's nervous about undergoing surgery, and especially, gynecological region? Any calming tips जो आप देते हो before, or what is your personal approach to this whole thing?
See, it's truth that any person who is going to have surgery will be anxious. Even I'll get anxious if some of my own relative or somebody is going to get surgery. I being despite being a doctor, then also I'll be anxious. That is absolutely true. So the most important thing is कि we generally explain the patient everything कि क्या disease है नाउ एंड हम क्या करने वाले हैं, ठीक है? तो पेशेंट शुड नो एवरी एस्पेक्ट ऑफ द सर्जरी कि हम क्या करने वाले हैं, कितना टाइम लगेगा, हाउ मच टाइम विल इट बी टेकिंग, एंड व्हाट विल बी द रूट ऑफ एनेस्थीसिया. So if we explain the patient or their relatives in detail, so 50% of their nervousness or anxiety goes. If we properly explain them the procedure and why we are doing this procedure, and obviously the most important thing is keep talking to them, and tell them that have faith on God, and basically this only we generally tell them ki have faith on God, practice let go. See, and you have, if you will be praying, and then both of us will be in the will be going will be going right. So in this way only we generally explain our patients.
Try to talk to the
Yeah.
patient.
Yeah.
Wonderful. अभी बहुत there's a lot of talk going on between about natural childbirth versus C-section.
Yeah.
So, आप क्या personally do you help an expectant mother to make that choice, or how do you approach that?
Yes, see, natural birth is definitely better for both the mother and baby. Okay, because there are many, it's natural. Okay, it's, you do not have to go for any cut or anything like that. Natural birth is anyways better. And generally, if a person is consulting throughout the 9 months, we keep them explaining कि ठीक है, ये do these exercises, do have a keep a watch on your diet and everything, so that you can go into natural labor pain. We generally make them mentally ready also that कि ये सब problem होती है, and you'll have to take care of your diet and you have to do exercises. आप कोई exercise मत करो, कोई walk नहीं करो, and last में आके बोलो कि भाई normal labor करा दो. तो generally उस समय patients they are not, sometimes they are not even capable of bearing that labor pain. So
Of
it
course,
takes a whole
yeah.
3 4 months. Exactly, it takes a lot of effort to make them mentally and physically ready for the natural birth. And
Mm.
see, in generally in India, and particularly where I am practicing, people prefer natural delivery only, rather than going for cesarean section. Yes, but there are certain circumstances when obviously natural delivery is not possible. To safeguard the both the mother and baby, we have to go for cesarean also. So I don't feel that cesarean is bad, but cesarean should always be a second option when you cannot deliver them naturally.
Of course, of course. True. Now, let's talk a little bit about mental health during pregnancy.
Okay.
So can you give some tips to women who may struggle with, anxiety or just overall,
Yes,
during that
yeah.
time?
Actually, mood swings are very common during pregnancy, and it is basically due to all these hormonal changes.
Some of the
And it is
changes.
very common. Sometimes you cry, sometimes you laugh, sometimes you are very sad for no reason, and you fight with your partner or with your family members, and then you realize that why did I fight for, and there was no such particular reason for that fight. So, but it is very common. The only thing we have, first of all, we have to explain to the patient and to their partner, particularly partner and the relatives, that it is very common. You have to pamper this pregnant woman कि अगर वो कुछ बोल भी रही हैं तो ठीक है, थोड़े से शांत हो जाओ and listen to them. And secondly, we can explain them कि ठीक है, although mood swings are common, but ठीक है, you'll have to take care of your health, मतलब this mental health. So you can do yoga, you can do meditation, you can listen to music if you're feeling sad or you're feeling dull, and you can keep reading good books throughout 9 months. You can read spiritual books, or you can read some pregnancy books or parenting books. You can keep those books so that you can calm down yourself whenever you are feeling anxious or nervous.
Fantastic. Wonderful tips. Thank you so much. Now, we've always heard that surgeons have very interesting stories to share. So we'd love to hear about some memorable moments or memorable experience, if you've had any, inside the operating room.
Inside operation, yeah, actually, I just one case I can never forget. That was a case of ruptured ectopic. Actually, ruptured ectopic is a condition in which the pregnancy occurs inside the tube, and then tube ruptures and the bleeding starts, and whole of the abdomen gets filled with blood. And usually there is huge blood, matlab 2 to 3 liters of something like that. And I was operating that, and blood started. Matlab there was almost approximately 3 to 3.5 liters of blood inside the abdomen, and we could not visualize any other organ because of that blood. We were doing suctioning, and repeated suctioning we were doing, and at that time, patients' this blood pressure also started falling. Everybody was so panicked. Anesthesia team was panicked, and staff was panicked, and we could not find the source of that bleeding, because it was completely the vision. We could not have any vision because of that blood. So that was really for I was really praying to God कि कुछ रास्ता दिखाओ मुझे, कुछ रास्ता दिखाओ, because as a surgeon I would say कि जितना डर रिलेटिव्स को बाहर लगता है, सर्जन को उतना ही डर अंदर लगता है. We never want our patient to get complicated or lose it, or we never want them to be go into complications in any way. So finally, after a lot of suctioning and all, we could find the bleeders, and then we clamped and did the surgery. But that was really, I cannot forget that scene ever in my life.
I mean, absolutely. That is something I must say. Absolutely. Now tell us about, Akanksha when she's not in the operating room.
Mm-hmm.
How does she unwind?
Unwind. See, actually, I am a very much family person. Like to spend when I am not in hospital or not in my professional place. I usually try to spend time with my family members. So I mean, I like to spend time with my children. I love reading books, or for them storybooks or something, or playing with them. So I usually find joy in spending my time with my own family members, particularly my kids.
So tell us about how you spend time with your kids. I mean, of course, you
I
spend time with your kids. I mean, what do you do?
Yeah, I generally, my favorite part and what I enjoy with them and they also enjoy with me is reading books, storybooks, or reading books. Sometimes we make some things like lemonade we make together and drink, and sometimes we just play. We go outside and play, and they just ride the cycle, and we just start playing with each other. So anything, I mean, when I am with my kids, I enjoy almost doing anything. I like doing gardening with them. I like reading books with them. I like playing with them. Sometimes even we watch their favorite cartoon shows together. So everything is fun with them.
Wonderful, of course. Now, tell us about work-life balance. As a surgeon, what is your take on that whole topic of work-life balance?
See, that is actually very much very important thing to have a work life balance, because see um, uh, as a person, you are someone taking care of the patients, doing surgeries, and this job is actually very stressful. So from 10 to evening 6, from 10 a.m. in the morning to evening 6, you are completely busy. But I usually try to, whenever I go home, I first of all, the first most important thing which I do is I switch off the data. So that I am away from all WhatsApp, for this Instagram and Facebook and all social media. I switch off that complete mobile data. I switch off, and then I try to spend the whole time with my kids, my family, till 10 a.m. in the morning, when I am with them, so that nothing is disturbing me apart from this after 6 p.m., so that I can have a very
Completely
quality time
focused,
with my
completely
friends. Yeah,
focused. Yeah. Or else,
yeah,
today, in these days, I mean, of course, or else it's very difficult to have that balance for sure.
yeah. And that is actually that is only possible when you are truly, I mean, when we focus on when we focus on our family, that
Okay.
no, family is obviously more important than anything in this world. So after job, you should have complete focus on your family. So usually I do that after 6 o'clock. I'm not much very worried about all these things, and usually I go and focus on family. And for that, you need a very good professional team also, so that when you leave the hospital, you know that your
Absolutely.
patients, your
Because
everything
exactly,
is will
because
be
you have such an
perfect.
intense
Huh.
job, it's a very
Huh.
intense
So
job, and of course,
yeah, so you have to choose the people, your staff, your professional team very wisely, so that when you leave the hospital or the premises after 6, you know that everything
everything
is
is
going to be
sorted.
taken care
Correct,
of. Yeah.
correct, correct. Absolutely, absolutely. So, has there been one piece of advice that you've received early on in your career, which probably is still stuck with you?
Uh, I don't remember such actually, because actually I'm a girl who was the only person selected in the medical
Wonderful.
in the past 50 years from my own area, and that to a girl. So I have been, so I have been, whatever I have been till now. It's all because I have been taking risks, and then sometimes I used to take risk. I used to gain something from that. Sometimes I used to take risk, and there had been so many failures, but yeah, from that failures I have learned also. I have learned the life. I have learned
Yeah.
in my career also. So at present, I don't think I have missed anything, but yeah, I can tell that I'm still in the learning phase. So
We all are. We all are.
yeah,
I think that's the key of life, that as long as you learn, you're living as long as you're
yes.
learning, you know.
So it's better. It's always so I always feel ki rather than having guilt for anything, we should basically focus on what we have learned from the last 10 years or 15 years or something.
Absolutely. 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 Now let's talk about the medical technology, the field of medical technology that has been constantly evolving. So, how do you see the future of laparoscopic surgery?
Yeah,
You know,
see, the laparoscopic surgeries are on hike. Even now, too, there people are doing robotic surgeries also, and that is absolutely even more advanced from laparoscopic surgery, and
Exactly.
even more and more things are coming in the robotic surgery. Also, more and more advances are coming, in which and they are very beneficial for the patients also, because the recovery time is reducing. I previously, after doing open surgery, I mean, suppose I'm doing hysterectomy open surgery, people used to take 4 5 days to recover. Now in laparoscopic surgery, they hardly take 12 hours to recover. To stand up and to take food by their own. In robotic surgery, even that time is getting reduced. So advances are coming, and I think like in technology will always be growing only, and in that field, in that way, medical field is also going to be on the hike only.
Of course, of course. Now, what are the key things you wish all women knew about their reproductive health, and which you think that could potentially become complicated in the future, but you think that something that they should know?
Yes, the most important thing which I find particularly in India is nutritional deficiency. Be it adolescent, 15-year girl, 25-year woman, 40-year woman, there is a massive nutritional deficiency, particularly of iron, vitamin D, and calcium. And people are not even
Hmm.
aware. मतलब हाँ थकान लगती है,
Exactly.
थकान
हाँ,
लगती है,
हाँ,
हाँ
हाँ.
थकान लगती है, इरिटेशन हो रहा है, ब्लीडिंग ज्यादा हो रही है, but they do not know why is it is happening. So
Hmm.
even now the researchers are telling that vitamin D3 deficiency is associated with so many hormonal changes also. And you keep on people keep on taking this hormonal medicines, and they do not know that simple vitamin D3 is deficient, and because of that everything is happening.
People are.
So
So
huh.
vitamin D, calcium, and iron, you said.
Yeah. So, because generally people do not take calcium supplements or iron supplements during pregnancy, and even after breastfeed, during breastfeeding, they do not take calcium.
Hmm.
And it's proven that we, as a woman, when we are breastfeeding, we lose 3 to 5% of bone mass while breastfeeding. So you definitely need calcium and vitamin D3 during breastfeeding. So the most important thing is nutritional deficiency, which everyone should take care, get tested, and take the supplements with the help of doctor, so that if we are properly nourished, everything will be fine. I mean, our hormone will be doing good, our tissues or organs inside will be working well, we aging will be delayed, so everything will go in a better way. So we should take care of our nutrients, our nourishment properly.
Now, do you suggest that women above a certain age or a certain age should just take certain supplements like you just mentioned, regardless? Or is it like you get yourself tested first and then you take the supplement?
See, if you are high risk, like you are pregnant or you are breastfeeding, ठीक है, or you are premenopausal, postmenopausal, then you should take you should take vitamin D3 and calcium supplements regardless of the any prescription. Otherwise, if you are not you are not in coming in the category of this high risk population, then you can meet your doctor and get tested, and if you are deficient you can take the supplements. And most importantly, particularly for the woman, is not to ignore any symptom. Particularly if your body is giving any symptom for more than 2 weeks, please don't ignore it. If you are having abnormal, initially you are having normal bleeding, now you are having abnormal bleeding, irregular bleeding, you are having vaginal discharge persistently, you are having itching over your perineal region, or any symptom, suppose cough you are having for more than 2 3 weeks, please go and visit your doctor. Don't ignore your symptom if your body is particularly consistently giving you any symptom for more than 2 weeks. So
Hmm.
most important thing, particularly for the women, because the women generally they do everything for the children and for husband or family, but generally they ignore
Their
their
own.
own health.
Yeah. Yeah.
Yeah, and sadly in India, this cervical cancer and breast cancer is on the hike, and despite of all these tests and some everything, people generally come in the advanced stage 3 and stage 4, and that is
Hmm.
really sad part.
That is true. Now, this is an interesting question. So now, tell us, if you weren't a laparoscopic surgeon or a gynecologist or a OBGYN, what do you think that you would be doing? That's why I
See,
said it's an interesting question.
okay. Actually, maybe I would have been a teacher.
Nice.
Because I used to learn and distribute, I mean, teach everybody who whatever I have learned, and because of that only, maybe because of that feeling or that perseverance only, I have started this social media and everything, so that I can share all about my, I mean, learning and everything. So if I wouldn't have been a doctor, I think I would have been a teacher only.
Super. Wonderful. We'll get to your social media as well. But before that, tell us what is your favorite tool in the operating room? Do you have one? Which is like, that is we've heard that,
Tool, favorite tool for a surgeon is scalpel only. Because we know कि भाई हिंदी में हम इन हिंदी में टेलना है कि भाई काटना है सिलना है, तो एवरीथिंग काटने का we start with scalpel. And obviously, but that is sometimes we should know कि कहाँ काटना है, कितना काटना है, कैसे काटना है, तो scalpel is my favorite tool.
so if you could have a superpower for a day,
Mm-hmm.
what would that be and why?
Superpower for a day. Uh, Superpower for a day. Uh, um, I mean, superpower in the sense of what? I could not understand your question.
Superpower matlab कुछ भी, like, we hear about these mythical characters that, कुछ स्पाइडरमैन की तरफ कुछ पावर हो जाए, कुछ ऐसे कुछ पावर हो जाए, इनविजिबल करने का पावर हो जाए, अ,
Okay, okay, okay,
ऐसे
okay,
कुछ.
okay. See, truly speaking, what I find most sad in my profession is that कि having a girl baby, particularly if you are having second or third girl baby. So people are like, ठीक है पहला तो ठीक है गर्ल बेबी हुआ इट्स ओके, particularly I'm talking about India, not aware of other countries. Second girl baby में मतलब एक अजीब सा डिस्गस्टमेंट आ जाता है in everybody, in relatives, parents, even the mother also. So if I have a super power for one day, मतलब I would do something कि कुछ ऐसा हो जाए कि इंडिया में लोग वो करे कि ठीक है कुछ भी हुआ है इट्स माय बेबी, एंड आई हैव टू चेरिश दैट मोमेंट, एंड आई हैव टू उसको पालना है, एंड आई हैव टू गिव देम अ गुड career or future or something like that.
Good. Basically, you just want to take away that ill feeling from people and just replace it with like happy feeling.
Yeah, exactly.
सबके साथ. Wonderful, wonderful, absolutely. So tell us what is next for Dr. Akansha Shrivastava. आपका future
So,
plans क्या है and all of that.
future plan, abhi to it's like growing in my own field, because I told that we everybody is learning on daily basis. So just apart I'm whatever I'm doing, I'll always try to grow more academically, surgically, and even I'm trying to do, I'm focusing ki next few years, maybe when my kids grow up, I'll be trying to go for robotic surgery also. I will try to go for do some workshops or some fellowships in robotic surgery also. So we'll have to keep growing.
Absolutely. So how would you like to be remembered by the medical community?
Yeah, I will always want ki yeah, she is people should have faith कि ठीक है इसके पास चला गया है, now everything will be good. So sorry, you asked for medical community, right?
How do you want to be remembered by the medical community?
हाँ मतलब बेसिकली यस, So by medical community also, I would like to remember it as ki theek hai, if if someone has gone to Dr. Akansha, so she'll give good advice. She'll
Good
do
advice.
whatever the good,
Yeah.
yeah, good whatever. I mean,
जो भी चाहिए
good
वो
she
कर
can
दिया.
do.
हाँ हाँ
Ha,
हाँ.
she can
Correct.
do, and even surgically also she is sound. So anyone can refer to me without any second thought.
Perfect. Perfect. Very, very cool. Now tell us about your social media. वो
Social
वो
media.
journey कैसे शुरू हुआ? What was it? Because not many doctors actually think of social media, and we are blessed that a person like you actually thought of social media to spread the knowledge. So
Yeah.
आपको कब ये thought आया कि I should utilize the platform to make sure that I can spread my ideas, spread my knowledge.
Yeah, actually, it has not been a very long journey. It's almost 2.5 years journey.
Hmm. Hmm.
So sometimes what happens, you have so many patients in OPD and they have so many queries, and particularly if they are pregnant. So and sometimes you do not actually we do not have time to solve all those queries, okay? Because when one person is inside the room, other is waiting. You cannot spend so much of time solving their queries. So, but gradually that there was a feeling inside me that I somehow I cannot give what I need to give to them. So I started sharing all these small queries on this Instagram and Facebook, and gradually the people started liking, and even my own patients who come to OPD, they started following this, and they now know that ठीक है अगर apart from the OPD, if I have any doubt, they can scroll down. And I think related to pregnancy and delivery and breastfeeding, I think I have covered almost all topics. So if any one of them have any query, they can go through it.
I think that is a fabulous thing which you have done, because absolutely, particularly women's health, there is so many questions that people ask women. We have them all the time, and we don't know, at times doctors are not as accessible as well.
Yeah,
So, which is
exactly.
absolutely, so. Thanks to you just for that. Now tell
Thank
us
you.
about follower moment, fan moment, follower. You have a great fan following.
Yeah.
So tell us about that. That how do you interact with them? If you've had memorable experiences with them, आप DMs का कैसे handle करते हो and all that.
Yeah, actually, that is actually a very good feeling also, because apart from getting connected to my own, I mean, city or something, through this social media, you are connected to almost whole of India and even outside India also. People are there who are consulting online from outside India also, and I usually get DMs like, "Ma'am, I have followed you throughout the pregnancy, and you have and I got cleared all my doubts and everything, and I am blessed with a baby boy, I am blessed with a baby girl." And they actually share this kid that I have been following, I am from US, I am from Canada or something like that. And that really feels good ki theek hai, matlab, it's not only the particular place where you live in, you are getting connected with so many
You're
people,
actually making a
and
global
that
impact.
yeah, and that is actually giving us emotional kick also to us,
Absolutely.
because yeah, it gives emotional strength to us also. Yeah, कि ठीक है, I'm doing good, and I have to keep doing this in the future also. People are liking your work or your page, and so I have to keep improving, I have to keep doing this.
Perfect. Perfect. Absolutely. So now let's jump to some rapid fire.
Okay.
Yes. So if you could switch lives with any other doctor for a day, which specialty would you choose?
Apart from gynae, I would choose pediatrics because I love children. So, so if I don't get to deliver my babies, I would at least spend time with the babies and other children.
Wonderful. Excellent. Excellent. What would you say is the most underrated part of being a surgeon?
Being a surgeon, underrated part is like your life is completely, matlab, you are under stress throughout 24 hours. And because surgery is in itself a very stressful procedure, because throughout surgery our adrenaline level is very high, because we have to be completely vigilant. And even after surgery you are always conscious that मतलब patient का सब सही सले हो जाए, कुछ problem ना हो. And being a gynecologist, you are not free even at the night, even midnight calls can come, midnight surgeries can come. So it's a bit stressful job.
Of course, it's a hugely stressful job.
Yeah.
Being a surgeon itself is a hugely stressful.
Yes.
So tell us about what's your secret weapon to stay calm under pressure.
See, it's firm faith on God, because if we have firm faith on God, at least we have a confidence that ठीक है, संभालेगा वो. छोड़ दो उसके
Absolutely.
ऊपर, संभालेगा वो, तो वो,
Absolutely.
हाँ, yeah.
Fantastic. Absolutely. So, what's that one word your patients use to describe you?
Most of my patients tell that she's a very smiling doctor. So,
You are. You are. You
yes.
absolutely are. Absolutely.
So they are like, you'll always find a smile on her face. Even if you ask any question for 15 times, she'll just smile and reply. So most of my patients are like, yeah, she is a very smiling doctor.
Wonderful, wonderful. No, and that goes a long way, because लोग तो डरते हैं डॉक्टर्स के पास आने के लिए,
Yeah.
but I think when they see you, they'll automatically get a boost,
Yeah.
and
So
I think that's very
sometimes even
important.
आजकल most of the patients like they'll read from the Google and they'll come. So even in that case, I just smile and ठीक है, बताती हूँ, बैठो. Oh, I'll now I'll describe you and everything. Sit here. So they are comfortable with me.
Wonderful. Now, if you could give a piece of advice to your younger self, what would that be?
Younger self, I would say focus more on your health also, apart from doing work, because yeah, it's very common that when we do mbbs or ms, we generally forget our own health, and it's very common.
Hmm.
So I have never taken care of my health in the last 10-12 years. But yes, that I have realized now that I have to take care of my own health also, which I am very well taking care of as of now. My diet, my exercise, my meditation and everything from the last 2 to 3 years. But yes, I have ignored that in the last 10 years during my this medical journey.
So you think that's an important, absolutely,
Yeah.
and that's a fabulous piece of advice, I think, for regardless everybody, and especially women.
Yes, yes,
So
definitely.
now, a favorite motivational quote to kickstart your day.
Motivational quote which I usually, there's always in my mind that consistency is the key, because circumstances changes, our mood changes, our capacity may change on daily basis, but one thing we have to remember that we have to be consistent. So when we are consistent, ठीक है, it takes time but things will change.
Consistency is the main thing. I think that's a very, very key word in every field and every aspect of your life.
Yes,
You know,
because
अगर आप
apart
consistent
from
हो
that,
तो
everything can
your
change.
goal.
But if we
Yeah,
are consistent, we will reach our destination.
100%,
Sooner or
100%,
later, we will reach. Yes.
100%. So, what's your biggest inspiration in the medical field or life in general?
See, biggest inspiration for me is to fulfill my purpose of life. Every person should have a purpose in their life, because
Absolutely.
if you are not having any purpose, you are wasting your life basically. So, khana, pina, kaam karna, ghumna, it's another thing. There should be a strong purpose of life, and uh, you should try to reach that purpose on daily basis.
Now, what is your? We would love to know about what is Dr. Akanksha's purpose.
That's a secret at this time. I
ठीक
would
है.
not
No
reveal it.
issues, no problem. We'll keep that a secret. We'll keep that a secret. Now, what's your favorite way to celebrate after a successful surgery?
See, generally after any successful surgery or any hard medical case, we generally celebrate it with my entire team, and generally I call my team from the ward, team from the OT, and management and everyone, and we generally cut the cake or some bring some sweets or something, and generally I ask them to order ki whatever you want, you just order whatever you want. So I like to celebrate with my team whenever I am successful.
Wonderful, of course, of course. Now, what is your life mantra?
Life mantra is two things: firm faith on God and karma.
Wonderful.
uh,
Very key.
yeah,
So both are very key.
yeah, you have to have firm faith on God so that you are basically strong enough to deal with anything in life, because you know that someone is there to help you or to protect you. And second thing is karma. I mean, you have to do your karma, and you have to do it sincerely. And when you are doing your karma, the whole universe will always is always ready to help you.
Absolutely. Absolutely. Very, very, absolutely very true. Because I also believe in both of them. That's why I'm just like a little, I'm like, absolutely very true, very true. Wonderful. It was so nice chatting with you, Akanksha.
Okay, thank you, Devika. Thank you
And
so much.
yeah, all the best for everything that you're doing. Doctors, as they say, that, blessings from God. So, all the very best with everything.
Thank you so much.